Opposed, second.
All right, at this time, I'm going to call the meeting to order, and I'm going to turn it over to our co-chair, Commissioner Pope, if you will, lead us.
If you would, please join us in the pledge of allegiance, and then, Commissioner God, we invite you to do the invocation. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Let us pray. Most glorious and almighty God, we come on this wonderful day you have given us. Thank you for life, health, and strength, the sunshine that shines over us. So in this meeting, give us the wisdom and knowledge to have some listening ears. Give us a heart to receive. And then, Father God, when all of this is done, we just pray, Lord, that we take the right steps towards the right direction. Thank you for Sampson County, how you mold us and keep us together. Let us work together, that it'll be a safe place, a better place. Thank you for each one that's here today and all that they do. We just give you glory and honor through your name, for you're worthy. In Jesus' name we pray. Amen.
Amen. Thank you, sir. All right, before I turn this over to Mr. Van, I just want to remind everybody, I think I sent everybody something, we're here today to learn. We're here today to listen and to get some direction of what's coming up for the next year. So, as you said in your prayer, we need to have a very attentive ear and listen to what's being given to us, and hopefully that we can take what you guys give to us over here and you, and we can make very good decisions going forward. Mm-hmm. So at this time, I'm going to turn it over to you, sir.
Okay, thank you, Mr. Chairman. I really appreciate that. I appreciate the board, your willingness to be here this evening, as well as the guests, and as well as key staff that we have here who have worked very hard to put information together to be able to present to you. I know that I certainly appreciate their efforts with that. The purpose of tonight, obviously we want to kickstart the new budget cycle for the 26-27 fiscal year. As part of that, we'll talk a little bit about the county's financial position, what we're looking at with future revenue growth and things that we need to know in order to make key decisions with the budget. And I want to mention that for the benefit of the media and the public, this is simply a starting point. This is the first of many meetings to come up over the next few months as we do planning. And so this is really meant, board members, for you to hear all of the information, as you said, to be able to process it. We're not asking for decisions to be made tonight. We just want you to know about the various things we're dealing with, faced with various, impacts coming down from the state and federal level, and just to be able to understand various options that staff has determined that may be some possible, solutions to consider. Some of those which may be a little controversial, but it's a matter of just trying to work through it and just lay it all out there to see what we have to work with. And I'll just follow through with the agenda, and I'll try to keep everyone on pace with where I'm at. That was item number 3, and now I'm going to go down to item number 4, which is review of adopted strategic goals. This is obviously very important. I know last year when you worked with interim manager Jeff Hudson, you talked about the various strategic goals and objectives that you wanted to consider, what was important to you. And obviously as the manager and as staff, we have to consider the will of the board. We are here to serve the pleasure of the board and to help make sure that we are honoring your wishes and the things that you'd really like for us to pay close attention to. So last year when you adopted these strategic goals, the goals are excellent government, safe community, public education, growth and infrastructure, healthy community, economic development, relations and connections. All of those which you see on the screen up here. Obviously there's a lot of subcategories, sub-points of emphasis about how you achieve those strategic goals. Obviously some of them we have already made great strides with. Some of them are a work in progress. We're still trying to get to where we need to be with them, and we will certainly keep working at that. But Commissioners, the main thing I want to know from you, is there any one of you who would like to see changes to the way these goals are written as far as those, all of the various goals and the points, the descriptors, if you will, under that? Board members, is everybody still good with maintaining those same goals that you've already put into place?
Yes.
Yes.
Yeah.
Yes.
Okay, perfect. Perfect. So we'll be able to just move on then, and we'll just make sure to honor those in the various decisions that we make along the way. Now I'm moving down to number 5 on the agenda. And this is related to a resolution for budget guidance that you also put into place last year. And I want to commend the board for doing this. This was very helpful to me coming in as a new manager, and I certainly appreciate all of the work that you put into this information. So with this comes 15 items that were adopted, and obviously this is way too numerous to sit, and I don't plan to read through this for you either. However, I would like to hit on the top 5, maybe 6. So first of all, I'm going to mention there will be no general county property tax increase. That was number 1 on the list, and we know that we have to live by that. The county will fully fund the Sampson County Public Education funding formula to recruit and retain highly qualified employees, and increased investment in employee pay of a 3% COLA plus a one-time $500 bonus shall be the goal for all permanent full-time equivalent employees. Next would be any increases in staffing in general fund departments shall be offset by equivalent cuts to recurring expenditures within the total combined general fund departments, or alternatively are grant funded. And I'm going to mention 2 more here towards the bottom. Fire tax rate shall follow the 2025 Fire and Rescue Services Agreement Amendment, including the recommendations from the Fire Commission. And then finally, the Economic Development Director shall make a recommendation to the county manager concerning necessary infrastructure improvements to the county industrial parks. Okay. And now I'd like to move on to number 6 on the agenda. And please, board members, if you have any questions, feel free to stop me along the way. So number 6 is major revenues and fund balance overview. And in just a moment, which I'm going to go ahead and ask if you don't mind, Jim Johnson, our tax administrator, he's going to join us up here. And the bulk of this conversation is going to be presented by both Jim Johnson, tax administrator, and Melissa Burton, our finance officer. But I do want to just mention a few things here, and especially for the public. The first step in budgeting is to understand, using the best projections and estimates possible, what funding may be available during the upcoming year. It is important to highlight that all budgetary funding projections are, in fact, projections. The tax office and finance offices do the best to estimate what may be available, but this number is always different than actual tax collections. This is true for every city and county. It happens everywhere. Nonetheless, using our best data, we attempt to project the major sources of revenue that the county relies upon annually. Not only is this important for the county, but it is also important for other units of government, such as our 2 school districts, as well as all our volunteer fire departments that rely on funding formulas and tax rates tied to property or sales taxes. Please note that there are other budget drivers, such as intergovernmental funds, which is money that we receive from the state or federal government, that do not fall under the purview of the Board of Commissioners. Today, we seek to focus on 3 areas. the sales tax, the property tax, and our fund balance, which is the savings for the county. And at this time, I'd like to turn it over to Director Melissa Burton for her to start with the sales tax.
Good afternoon, Commissioners. I would like to take this opportunity to talk to you about our two primary revenue sources, those being sales tax revenue and property tax revenue, and then afterwards to briefly touch on fund balance appropriation and its history within the last 5 years in the county. As you'll notice in this slide, our current general fund budget for sales tax is $16.5 million. Currently, we're capping the expected growth at 3%. Stephanie, can you move to the next slide? I did a history of the last 5 years of sales growth, and as you can see, except for kind of like one blip in 22-23, the percentage increase over the previous years kind of steadily dropping. So between 23-24 and 24-25, there was only a 3.24% increase. So that's why for right now, we thought we would cap the expected growth with the 3% increase. That would put us at $16.995 million. Two things that's important to note. One is that we're only have 5 months of sales tax revenue data because it's 3 months behind as far as reporting from the state. So it's kind of hard to gauge at this time how far ahead we are of the budget. And then secondarily, any additional revenue sources or revenue funds that we have, 25% of those are committed to the school system for the funding formula that was passed last year. Move to the next one, to the property tax one, Stephanie. Tax-based growth, we use $7.225 billion as our base for last fiscal year's projection. Jim's first estimate for this year came in at $7.422 billion. So that's an increase of $166.389 million over the current fiscal year. Collection rate, we're going to, at this time, stay at 97.5%. And so with that increased property tax base, which is basically just solely based on growth, which Jim will go over a little bit more later, that puts an additional $1.3 million of revenue over the current fiscal year. And again, to be reminded that 25% of any additional revenue that we're expecting is committed to the school system for current expense funding based on the funding formula from last year. So if you look at the final calculations, a very modest increase in expected revenue out of those two major revenue sources. If you take out the amounts that are committed to the school system, it's only about $1.3 million. And then lastly, just a quick touch on the fund balance appropriations. You can go to the next one, Stephanie. As you can see, they stay relatively low. There is 1 year in 23-24 where there was a bump for salary increases from the pay study. And then, of course, the infamous 24-25 year where $11.5 million in fund balance was budgeted. Fortunately, due to excess revenues and expenditures coming in less, at that time before Mr. Hudson came, we were kind of under, I say we, when the budget was done, they were kind of underestimating the revenue somewhat, so that they were coming in a lot higher, and they were also maybe had too much in expenditures that weren't actually to be expected to be spent. So for that reason, that fund balance amount dropped drastically. It's only like $1.6 million that was used instead of $11.5 million. So that is the good news. And then last year, of course, we just did $1.6 million. And just to note that using fund balance is a normal part of budgeting. It's part of the local budget fiscal control act equation for balancing a budget. But you just have to be really strategic in how you use it. And I think that's it for me. At this time, I'm going to turn it over to Jim Johnson, Tax Administrator.
Okay. talking about our tax base and looking at the components that go into estimating our projected tax base, certainly we got our real estate, which is typically on an average non-reevaluation year is roughly about $100 million in increase based on residential new construction that we pick up. Unlike many counties around us, we don't have a lot of industrial, commercial new construction each year. So we typically, somewhere around $100 million we pick up each year. Then we have our personal property and our business personal property, which is a lot of times like hitting a moving target because the listing period is in January. February, we're looking at numbers and we're keying listing forms in right on up until June. So we take a good hard look at the current year that we're in and try to estimate what we think personal property values will be. Public utilities, we typically estimate them to be 100% of the current year. We get those from Department of Revenue in September. They say estimate 90%. I go with 100. It's always usually just a little bit more than the previous year. So we estimate it at 100%. And then finally, the motor vehicles. Motor vehicles, ever since tax and tag in 2013, it increases every single year. I mean, if you go back and look, we've estimated more projected revenue for motor vehicles every year. This year will be no different. We take 8 months of data that we've got right now and calculate it over 12 months to get a yearly figure to be projected for the next year. And Mr. Hudson touched on present use value last year. You know, we're a rural farming community. That's who we are. And we lose a lot of value, about over $800 million in value to the present use value program. So that's something that's, you know, kind of, it hurts us, but it's who we are. And the other thing we have to keep in mind is...
Excuse me, can I get you to roughly how much in revenue does the present use value of?
Typically about, in revenue, about $5 million, yeah, that we lose due to the PUV program. And then finally, there's a lot of talk, well, not necessarily just in North Carolina, but especially in North Carolina, about property tax reform. Nobody knows what that means. It could mean anything. It could be expanding exemption, creating new exemptions. We just don't know. We're trying to stay on top of it. I think they've had 2 meetings so far in the General Assembly to study it and talk about it, but nothing's been changed at this point. But what we find with the General Assembly, anytime they change something with property tax, it always reduces our revenue. Mm-hmm. So that's something to keep in mind and kind of keep an eye on. And I know the County Commissioners Association is on top of it. They keep us informed, and they've been asking for data, and we've been sending it in. But definitely something that could affect our property tax base, depending on what they do, if anything.
All right. Thank you, sir. Any questions for either of these two commissioners?
So $100 million worth of homes were built last year?
Typically, that's what we get.
That's a lot of houses.
Yeah, it is. Yeah, that's what we average each year. That's what we're estimating for the new year.
One more question. Do we keep up with, I guess you could say, the average age in the new homes and children? Do we keep up with that too through the property taxes? Or?
Not through property tax, we don't.
I'm just curious, because I know that goes a long way to affecting what we're doing.
Right. Yeah. Not for our purposes. We don't keep track of that.
Okay.
Thank you.
So Commissioners, I'm moving down in the agenda now to number 7. Excuse me. Budget priorities and budget drivers. So I can assure you, since I've been here, I've tried everything I could as far as learning the current state of Sampson County and working with staff to establish priorities. And I still continue that, and of course, I will continue that with the will of the board, as mentioned earlier, keeping that in mind as well. But I do want to mention to you that I'd like to highlight a few of the most important directives as I see them. First, there will be no general county property tax increase in my proposed budget. I will include funding for the 2 school systems per our funding formula. Third on the list is it is my intent to include a 3% plus $500 COLA for all permanent full-time equivalent employees. Fourth, I will forward any fire tax rate recommendations from the Fire Commission to the Board of Commissioners. And fifth, it is my intent to attempt to include an investment in economic development. Now, all of those priorities were thought of last year, and there are also other budget drivers that will likely have an effect on the budget, and staff would now like to share some of those with you. We'll go down through the list and talk about some of those. So I'm going to begin with letter A under number 7, just to talk about GFL. And board members, I know you're all too familiar with this, but we know that the convenience center contract expires June 30th. And that has the potential to have a significant impact on us. Basically, you're looking at $1.2 million annually that we would have to find, which we've not had to factor into the budget for the last couple of years as a result of the arrangement through GFL. As you know, we are working on negotiating with GFL. Matter of fact, I got an email late this afternoon where it sounds very possible we'll have a meeting within the next few days, and I'll share that information with you. But we're just hopeful that, in some form or fashion, we'll be able to negotiate this, that we don't have to find that amount of money within this budget process that we're working on. Letter B, New Hopton High School deficit. So I found out recently through Dr. King, superintendent with county schools, that they have a shortfall for the new high school, and it sounds that it could be, the way he's described it to me, anywhere from $6.5 million to $10 million. But what he has shared with me, because I asked him if they had done as much as they could in the way of trying to get the project within the money that had been allotted. He explained to me that they have done pretty much as much value engineering as they can at this time. And he said they had also cut some square footage out of the project from what they originally started with in an effort to do so. They're saying for the money, they won't know for sure where this will fall until the bids are officially received in May, as far as having the GMP, guaranteed maximum price. So it's just a matter of once again, we need to sort through this and have a little time to come together and meet and understand more about it. And we do have some options that I'll show you later in the presentation related to this as well. Now, before I move on to letter C, were there any questions about either one of those points that I just covered? And I'd like to ask Ms. Nancy Dillman, our HR director, to come forth. And we just have a multitude of HR considerations to discuss. And if you need help, Patty, you have handouts.
I do not.
You do not?
I do not. No,
That's
sir.
fine. No worries. Okay.
I just want to have a few minutes. Thank you, first of all, for giving me this opportunity to have a few minutes to talk with you, because we all know, and you don't have a handout on purpose. Former teacher in me says if I'm talking and you don't have something to look at, you'll listen to me. So if you want something afterwards, I'll provide it. But I would appreciate your attention to our most precious resource. We are in the business of providing services to our citizens. And in my opinion, and as we all know, we're only as strong as those people we hire to provide those services. And you also know we've had hiring challenges for some time now, especially in our unicorn positions, if you will, then we are competing with folks throughout for special skill sets. We're not talking about warm bodies, we're not talking about people, we're not talking about doing more with less, we're talking about doing differently. You have made a substantial investment in Sampson County infrastructure to allow us to do things differently. And we have to maintain that and keep it going and have the skill sets there to move forward with how we're doing. And we're experiencing growing pains throughout with our purchase orders, with our timesheets, as we move away from paper into electronics. But we're getting better, we're getting more acclimated to it. But we also have to upskill those people and enable them to deliver in a new manner. I do have some statistics, if you'll bear with me for a few minutes. I was asked to report to you on our turnover data. Whenever anyone leaves, I try to have either an exit interview or do an exit survey to talk to folks, especially if they've been here for some time. What led you to seek employment elsewhere? Why are you leaving us? Where you're going? As nosy as I'm allowed to be. I do not share who I've talked to or in what capacity, but I use it to look at patterns and overall trends for what we're hearing. And what I'm hearing is, and this is especially magnified since we came out of our silos with COVID, flexible work schedules, opportunities to work from home, and that varies by department. Better opportunities to apply my skills and my knowledge. That means greater pay, greater flexibility, greater benefits. And young folks have this work-life balance. I've never been able to accommodate that, so I don't know how you get there, but that's important to our younger folks. Greater opportunities for advancement. I can go up the ladder quicker. I can get more faster. We're not looking at people that are looking 30-year careers anymore. They're looking the here, the now, what you're doing for me today. More meaningful work that would define career ladders for my associated skills, and I want to be compensated for those skills. We've been successful in our public safety departments to be able to implement some career ladders and to give that upward mobility. That's harder to do with our smaller departments, but it's also something that we know we have to look at holistically. People are not looking to come in and stay in the same position for the most part. If Mr. Johnson has an opening in the tax department, I'll get 40 applications. It's not that way with my higher skilled nurses, social workers, law enforcement officers. I don't get those applications. So it's a challenge there to find these people because they have more opportunities. Right now we are budgeted at 553 full-time positions. That's not FTEs, those are just people, budgeted full-time positions, are fluctuating part-time. It varies depending on department, season, what we're looking at. As of Friday, we had 26 vacancies in the county. I will tell you that's probably one of the lowest vacancy counts we've had since I've been here, but remember how many positions we cut last year. So when you take that into consideration, we're not measuring apples to apples, but you all know we're looking at attorney, and you remember the challenge last time of finding interested and qualified applicants. We currently have 2 interim directors. That means we have current employees we put in positions to be the interim directors for those departments. We've got to advertise, we've got to backfill, we've got to find the best people and the best way forward, and is there anything we need to do differently? So those are 2 positions. We have 1 public works position that we're holding at bay until we get somebody in there. This is a facilities maintenance position. We're not advertising right now because we want the new director to have the chance to say, I need to move forward here and there. Is this a position we really need? Don't know. The sheriff in detention have 5 positions available for EMS. Now 2 of those are the 2 port paramedic positions that were just funded. So 4 paramedic positions. 1 in inspections and planning, and I will tell you inspectors are not begging to come here right now. We are trying to rebuild that department intentionally and strategically. 1 at the library that's been vacant for 7 months. We have 3 at the health department and no takers. We did have an interview, don't mean to say that, but it'll be down the road. We got to get the person certified, but everybody's not begging to be an environmental health specialist or a nurse. And we have 10 at DSS, and I hold my breath every day because those folks are in high demand for what we're asking of social workers and the environment we're putting them in and what we're asking them to produce. And you're going to hear more about newer challenges when Ms. Santos talks to you in a little bit, but 10 at DSS is on a roving basis, and she just lost a key employee who's helped her stabilize her personnel and work strongly with the administrative team. So right now, she's really trying to put her team back together to figure a way forward. And then we lost our GIS administrator, and that's a unicorn position. They don't make them. We created her, we built her, we made her, and she wrote a check and paid it all back and said, see you. Because she has opportunity, she can go. But the work that was done to move from a 911 addressing position to a GIS coordinator position and how that tapped with our tax office, our register of deeds office, our inspections and planning, she literally touched everything here, and we're in a bind until we can find somebody with the skill sets, and that person hasn't materialized yet. Let's talk a little bit about turnover. In January and February of this year, we had hired 18 new employees. Good news, 5 of those are rehires. They're coming back to us. Grass isn't always greener. One of them is a part-time, and 2 are the cadet positions we approved for the sheriff's office. At the same time, we lost 13 employees. 1 was a retiree, 1 was a part-time, and 1 was our unicorn I talked about. Now, when we talk about staffing shortages, you also have to consider all these other things that impact that. For January and February, we had 22 employees that were out on family medical leave. That means they ain't at work. 10 of them were intermittent. That means they're dealing with challenges. They can work part-time, but they can't work all the time. That's still, somebody's got to get the work done. We had 5 out on workers' comp. 2 of those were light duty, which means, okay, you can't do your full-time job, but we'll find a light duty assignment. We had an election season. We had somewhere that needed phones answered. We find a light duty assignment when we can keep people at work. 3 people on personal leave. That means they had not been with us long enough to be able to take FMLA, but they were allowed a personal leave of absence, and we had 3 on military leave. So add that to the vacancies, then you got all these shortcomings. For 2025, the whole year, pardon me, we had 106 new hires. 68 of those were part-time. A lot of that's seasonal with our Parks and Rec. And then you've got your part-time drivers and your part-time detention officers, part-time paramedics, but those are getting lesser and lesser. People aren't looking at those part-time gigs right now. We lost 110 employees last year. 32 were part-time and 10 retired. So out of the whole year, we lost 10 to retirement. Okay, 461 people on FMLA last year over the course of the months. And it might have been 1 person over 3 months, but when you add it all up, 134 of those were intermittent, and 16 we were able to accommodate with light duty. They couldn't do their regular job, but they could sit at a desk, answer a phone, do something light duty. 22 on workers' compensation means they couldn't work, but we did find jobs for 15 of them light duty. 8 were on personal leave and 4 on military leave. There again, those are holes that have got to be filled by somebody. Those are rights that are given to people by law. We talked about our specialized skill sets. We talked about our new folks not looking at a 30-year career. They want to know, what are you doing for us now? Where are folks going? Johnston County, Harnett County, Cumberland County, and into the private sector. Those are our biggest competitors because they offer more salaries, especially attractive to our social workers and our folks that are working on split schedules or night schedules or 24-hour shifts or 12-hour shifts. If they've got to drive anyway, they can drive a little more for money. But we know the challenges we have with those folks. We have implemented 2 pay plans in short order here. One was before I came here. Actually, the first one created the HR department, so I'm thankful. But it was implemented over 4 years because the county did not have the money to come in and do what the pay plan indicated needed to be done to make us competitive, and that was in 2014. What happened as a result of that pay plan, we eliminated longevity. I still hear about longevity all the time. You know, that's one of the things people, if we just had longevity back, if we could just get longevity back. But I will tell you, looking back, eliminating longevity and eliminating health benefits for retirees, I was not part of the process for determining when the cutoff date was. And it's painful for some people. I've got a young lady right now looking at retirement, and she's having to rethink, am I going to be able to retire when I want to, because she missed that cutoff date by 17 days. And where do you draw the line? Who do you change it for? Because when you start moving that line, you got to move it for everybody. And so a date and a time was picked, it was set in stone, and that's what we've operated ever since. Doing away with those two future liabilities allowed the county to realize a greater credit rating and refinance some of our loans and our debts. It was taking that liability off the table. We're not going to have to pay for that stuff down the line, so we've got money to pay our employees with now. That's where that came about. Doing away with the longevity. In 2015, we had 186 employees who received longevity that year at a cost of $186,861. 5 years later, 2020, we were down from 186 to 159 employees at a cost of $203,072. This past December, we pay it out first Friday in December, 2025, we've gone from 186 employees to 90 employees at a cost of $198,366. It's gradually being phased out, but the cost isn't going down with the raises that have been implemented for employees. Right now in December, we have 6 employees with over 30 years, and they're being paid 4.5% on longevity. We have 23 employees at 25 to 29 years, and they also being paid at 4.5%. We had 37 employees at 20 to 24 years, and 24 employees at 15 to 19 years at 2.25%. So taking that liability to the county allowed them to implement the money for the pay plan that was spread over 4 years. Also reducing or eliminating the health plan for retirees. Right now, we have 45 employees, former employees, who are still on our health insurance. We have 45 retirees. 7 will come off in 26. 22 total by 2031, and we're adding fewer numbers each year because of how long if they were not here to qualify. So those numbers are diminishing. That was the only way that the county at that time saw that they could implement the pay plan and do what needed to do it. Then we offered another pay plan in 2023. We eliminated the hiring rate, because at that time we had a hiring rate, a minimum, a mid, and a maximum. We eliminated that hiring rate that we kept employees on for their probationary period and moved right into the minimum, which allowed us to be more competitive with advertising minimum rates. So we felt like that was a positive move. But with both pay plans, the final word in both of them is that your pay plan's only as good as your maintenance of it. You can implement it all you want to, but if you don't maintain it, you quickly absolve the gains that you had there. So we were brought up, our salaries were competitive, we were doing great, but with not outdoing the COLA last year, and other counties did a 3 to 6%, it's added to our challenges, and it's cost us a few employees. Do we have to do another pay plan? Certainly not. We can do this internally. We can do it on a revolving basis. We can look at positions as people leave, and we do. It used to be we just backfilled. I've got a vacancy. This one's left. Can you advertise? Now we have conversation with department heads. Okay, let's talk about your structure inside. What do you need in your department? What skill sets are you missing? How can you reclassify or reassign duties to get the work done? Are there processes that you need to put in place that are going to help you be more efficient with less people? Not doing more with less, doing it differently. How can we do this differently? If we know we're behind in the market, we can look at certain subsets. We can look at job classes, we can look at departments, we can look at however we want to, and do that on a revolving basis. Every 3 years, every 4 years, you know your department, your job type, whatever's going to be reassessed. There are ways to go about keeping current without saying COLAs across the board, without saying we need to pay for another pay plan. It takes time and effort and planning, but it can be done. We need to make sure our job descriptions are being kept accurately and they reflect what we're doing, because we know that changes and sometimes those get stuck on the shelf. But we got to look at our work differently, and we've got to stop operating in silos. If nothing else, we found out how intertwined we really are. That what I'm doing over here is touching you. We all use technology. We all are using the same infrastructure. We all depend on the same financial processes. So we've got to work on doing that together. The county commissioners have done a lot for employees in the last 10 years. We've provided a lot of benefits in 2017. I'm going back, that's when I came. The third year of the pay plan, we got that third year raise, plus we got a 0.75% COLA. The next year, we implemented the final phase of the pay plan. There was no COLA. 19, a 2% COLA, plus we adjusted salaries for the time in the pay grade. In 20, no COLA. 21, 5% COLA plus another time in grade adjustment. 21, October of 21, we did a temporary raise for detention officers because we were bleeding detention officers and we knew that we needed to do something. So we implemented a temporary 10% raise that became permanent in January of 22. December 21, 2.1% bonus that was based on our June salary. That was like a COVID premium to reward employees for sticking with it during COVID and doing what needed to be done. 1/1/23, a 2.5% raise. 11/1/23, the new salary plan plus a 4% COLA. That was a big leap. 7/1/24, a movement to the midpoint. 1/1/25, as you know, a 1.5% COLA. And then our bonus last year, and I would be negligent if I didn't tell you how very much it has been expressed to me repeatedly from employees, how much they appreciated the 4 bonus days. That generated a lot of goodwill. So if we look at the raises from 7/1/21 through 11/1/23, our detention center employees received, on average, these are averages, 36.93% increase. Sheriff's Office employees, 35.18% increase. DSS employees, a 25.75% increase, and all other county employees, 24.47% increase. So across the board, you know, at least 25% increase on average in the last 3 years. I've talked to you about longevity. Now I'm talking to you about health insurance. Starting late last summer, in the rumblings, in talking with my cohorts and talking with folks in the insurance industry and talking with the agencies that I'm affiliated with, there were rumblings about what's happening with health insurance. The premiums are going to go up. The cost of insurance is going to go up, and it's kind of like Chicken Little running around. What's going to happen? What's going to happen? And 15% increase is what has been thrown out consistently as far as across the board cost. Well, we were fortunate in Sampson County for years. There were increases, but the county was able to absorb it, and the employees never really felt the pinch of increased premiums. Well, right around COVID, that was no longer the case, so some of that cost was passed on to employees, and in their premiums, our premiums increased. Then we were able to offer a dual plan. We now have a base plan, and we have the option for a buy-up plan. We've looked at our co-pays, and we've looked at all those things, and we've made needed adjustments to stay competitive. And our health insurance is pretty strong when you compare it to anything else around you. We're still with Blue Cross Blue Shield, but we're still shopping. We've always shopped. We've always looked to see if we could do better, and that's what we're doing now. We won't have third quarter data in until the end of the month, so it'll be 1st of April before we can give you hard numbers, or we can make a recommendation about what our opportunities might be. But that's where we are with health insurance. But what's making it rise? Well, cost of health care, the cost of procedures, the cost of medications. What we're really seeing an uptick in, not just in Sampson County, is the cost of specialty drugs, especially for cancer treatments and early intervention for those kind of diseases. Higher hospital cost, emergency room visits. I will tell you that was red flag for us 3 years ago. We looked at the number of our employees that were visiting the emergency room, and we're like, what's going on? Why so many people go in the emergency room? Well, that was right after COVID, and our urgent cares were not open at times that people needed to go to a doctor. So they'd either have to drive out of the county, drive somewhere else, or go to the emergency room. So they opted for the emergency room, which drives up the cost of our insurance, which is more expensive. And we tried really hard to educate our employees to help them understand opportunity. You don't go to the emergency room for an ingrown toenail. You tough it out, or you do something different till the doctor opens. But part of it was education, and part of it was just access to services. We have found that more people are accessing care, mental health and early onset diseases. There have been a lot of increases in mental health care, not just our employees. We're talking about nationwide trends. This big, beautiful bill we keep hearing about, and you're about to hear more about of it, but it's impacting the availability of services for everybody. And when services for everybody are impacted, that means somebody's going to be left paying more, because those that don't pay as much or anything. Let's face it, we got an aging workforce. People are working longer, they're aging longer, they're staying on plans longer. And then a lot of our health insurers have consolidated, and when you take consolidation in, you take the marketplace off and you don't have as much competition there. So all of those are drivers for what the increases are looking like. We're hoping that we're wrong, and we're hoping that it's going to come in less than that, and we're hoping that we can make some adjustments to our plan, but there will be increases this year, and how we're going to adjust those is going to depend on us. And as soon as we have those details, we will make it available to you. Those are the challenges that we're seeing in HR right now. Those are the things we're dealing with, because when we talk to you about turnover, and that doesn't even include the internal stuff where people change positions and move in and out of jobs, but people are looking opportunities, immediate opportunities, growth potential, and what are you going to pay me now? That is what I hear from our folks. And these hard to fill positions, we've got to look at not how do we classify, but there's certain skill sets we got to have to maintain the investments we've already made. We can't just put a warm body in there. We're going to have to find those social workers, those inspectors, those whatever, that unicorn I keep talking about. We've got to find those people to elevate our services if we're going to provide these services. Because there's not a wait and see kind of thing, and we can train our own and we can keep trying that method, but it's backfiring when, okay, you got me trained, thank you very much, and see you. And even with the contract, and you say, well, you'll pay us back, okay, here's your check, I paid you back, see ya. So those are not unique to us, but we are positioned in a unique place. Government moves slow, it doesn't move fast. We're methodical. I'm a Methodist, so I'm used to being methodical and slow, but we got to look at what our folks want, what's going to entice them, and then we've got to put things in place to help them feel supported, needed, and valued as delivering these services that we're required to deliver. And I'm happy to provide greater detail. I will have firm numbers for you later, but these are the talking points and what I'm going to be coming back to you with, just to set the stage for you. We've got some unique hiring challenges, and we're going to have to look at them differently. Same old mold ain't going to work for some of these jobs.
Do we have any percentage of anyone working from home?
It varies by department. For example, and I'm not picking on anybody, but DSS, by virtue of that, got room for all their employees. So that is one of the selling points for them, is allowing some flexibility to work from home for some positions. But it varies by department. We do not have an overall policy. But some positions do lend themselves to that availability as long as we have the technology and the support to provide that. Yes, sir.
Okay. The other thing, when you're saying when someone retires, sometimes the cutoff date is set. How can we help?
Well, that date was set for whether or not you're entitled to benefits in retirement. You change it now, you got to go back and change everybody that's gone since then. You can't. Well, no, never say can't. I don't want to help you.
All right, I just wanted.
Because they had to establish a date to say, and I don't know how it was picked. I was not here then, but they selected a date and they said anything after this date it wasn't like any new hires beyond here. It affected and impacted employees who were already here. So I don't know how the date was established or who was selected, but to change it at this point, you got to back up and change it for everybody. That's a lot of people, a lot of money.
Nancy, can I jump in and ask that we quantify what the COLA would look like?
I'm sorry, yes.
Back up one slide, if you will.
Yes, it's on the slide. I didn't turn my sheet.
It's okay.
Okay, what we discussed last year was a 3%, and this is what the cost would look like to implement that 3% COLA, the last one down there. This is based on our current payroll. This is without anything else occurring, based on our current payroll. And for comparison purposes, we also are showing you what a 1% COLA, every 1% we'd add to that. For example, if you want to give a 4%, you'd have to add that to the 3%. And then the one-time $500 bonus for permanent full-time employee. For full-time equivalency, that means our part-time people that work a regular schedule, so many hours, that we include them in that $500. That's what that cost would be.
Thank you.
And I'm sorry.
No, you're good. Thank you.
Any other questions for me? Thank you for your time.
Thank you.
Thank you.
Thank you, Ms. Nancy. So board members, now we're at 7D, an introduction to HR1 and the big beautiful bill and county impacts. And we have this video that's been, and some of you or all of you may have seen it, I'm not sure, but I think it would be good for others to see this as well. But it's produced by the NCACC, so we'll watch it. It's only about 3 minutes, very brief.
Hello, Commissioners. I'm Wallace Nelson, NCACC President and Pacomitas County Commissioner. I want to take a moment to speak directly to my fellow Commissioners and county leaders about our upcoming NCACC district meetings in early March. Quite simply, your presence matters. We're at a critical moment for counties. The decisions being made at the federal and state levels are having real, immediate impacts on our local budgets, our services, and the people we serve. District meetings are more than routine gatherings. They are working sessions that shape how we move forward together. On the agenda, we will be discussing updates on our presidential initiative, key association priorities, and important legislative developments. I want to especially emphasize the legislative updates. We'll be talking about HR1 and its practical implications for our county budgets, especially related to programs like SNAP and Medicaid. We will also dive into ongoing property tax reform discussions at the General Assembly, which could significantly affect how we fund essential county services. These meetings are a great opportunity to hear from each other and to build stronger relationships with fellow commissioners in your districts. So please, join us to share what's happening in your counties, what's working, what's challenging, and where you need support. When attendance is strong, our message is stronger. When we are aligned, our advocacy is more effective. And when we learn from one another, we are better equipped to serve our counties. I know schedules are always busy, but I encourage you to make attending your district meeting a priority. Finally, I would like to mark your calendars for March 27th for our first forum on our presidential initiative, Counties Care, Access to Health Care. We will be meeting in Raleigh to talk about the importance of health care and especially our rural hospitals. More information will follow, but I wanted to make sure you have March 27 on your calendars. So let's come together and lead together for our counties and for the people who depend on us every day. Thank you for all you do for supporting your association. I look forward to seeing you there.
So obviously with the NCACC,
Hello, Commissioners. I'm Wallace Nelson.
there's a lot of emphasis on the impacts being passed down related to SNAP and Medicare benefits from the federal and state level. As well, of course, they hit on property tax reform and what that, they're just monitoring these subjects for us, and we certainly appreciate their support and that we have them as a resource. Obviously, the combined effect of rising mandated service obligations and constrained revenue authority presents structural fiscal challenges that require careful planning, proactive modeling, and coordinated advocacy to ensure continued delivery of those essential services in Sampson County. As we know, both the Department of Social Services and the Health Department are the ones being most significantly impacted at this time. So I'm going to move to letter E now, HR1 and projected impacts to Sampson County DSS. And I'm going to ask Ms. Patty Santos, Director, and her team to come forward and come join us up here at the table and share your presentation with us, if you don't mind. And Commissioners, this presentation is actually towards the back of your books, just to let you know. Patty, please introduce your team to everyone too. Please.
Absolutely. So I'm Patty Santos, Director. This is Jane Dudley, Deputy Director. Anita Carlton, Business Officer 1, and Miss Monica Price, our Economic Program Manager. All right. So we're going to go ahead and get started. There is, and I apologize in advance, there is a lot of information and it is a lot of slides. But we try to narrow it down, but everything had to be said, which is why it kind of stayed the same. All right. We're first going to start with, HR1. What you're hearing that HR1, but that is also really the big, beautiful bill. So anytime you hear HR1, think big, beautiful bill. I know that was in the news last, 4th of July, and everyone kind of knows that. So when we talk HR1, it's the same thing. We'll move on to our glossary. In our world, we use acronyms for just about everything. So again, HR1 is a big, beautiful bill. Anywhere you see F&S, that's going to be Food and Nutrition Services, SNAP, which we will talk about in detail, Supplemental Nutrition Assistance Program. Now, along with SNAP, you have the EBT, which is the Electronic Benefits Transfer. That's the bank card that the SNAP benefits are loaded onto. ABOD is able-bodied adults without dependents. So when we start talking about Medicaid expansion, which is the next one, MXP, Medicaid expansion, that pertains to our ABODs, able-bodied adults without dependents. The PER is going to be the payment error rate. When we talk about Supplemental Nutrition Assistance Program, there's always going to be an error. When there is an error, that's the PER. CHIP is Children's Health Insurance Program. The SUA, Standard Utility Allowance, and we'll talk more about that when it comes to heating and cooling services. And then LEAP is your Low Income Energy Assistance Program. So this is a lot. All right, so these are the changes that we're going to be talking about. So HR1 makes changes to Medicaid and to SNAP, and we'll first review our Medicaid changes. So the first one is going to be qualified alien eligibility. So effective October 1st, 2026, beneficiaries with immigration status that is no longer eligible will be disenrolled from the Medicaid program. Notices are going to be sent out starting June 2026 to individuals to be reassessed. So it's not like you can just cut everybody off and be done with it. Letters have to go out, they have to be reassessed, and then the ones that are not eligible have to be disenrolled by October 2026. What impact does this have? This will increase the workload as these individuals still might be eligible for emergency Medicaid. So you're taking them off the Medicaid that they have now, and then so they disenroll, but if they have an emergency need, they can come in and apply for that because they still might be eligible for that. So instead of somebody having the service throughout, they have to apply during these emergency situations. Changes to the work community engagement requirements. So work community engagement really refers to the job requirements, the work requirements, that's what it's being called. So effective January 2027, beneficiaries receiving coverage through Medicaid expansion, again, that's your ages 19 to 64, must meet the work requirements or an exception to maintain coverage. So what is the requirement? It is 80 hours of qualifying activity. That can be employment, job training, community service, or volunteering 1 month prior to the application date. So if I'm applying today, last month I would have needed to work 80 hours or job trained, volunteered, or did something. Now, after I have the service, when it's time for me to do a review, within the past 6 months, I would have had to meet that requirement. So it's like it's a lot at the beginning, but then after that, once I'm on the service, I have to do the 80 hours within the previous 6 months. What impact does that have? That is extensive training for caseworkers. The potential need for more recertification staff, complex look-back periods. So I'm looking at 1 month beforehand when it's a new application, and then I'm looking at 6 months beforehand when it's a recertification. And cases will fall out of straight-through processing. And straight-through processing means that the system automatically will pick up the application and, puts it through the system and approves it. When cases fall out of that, it requires manual entry, which is just more work. Currently, we have almost 5,000 Medicaid expansion cases. So right now, those cases are being touched or worked once a year. That will just double. It will have to be touched or worked twice a year because the recertification periods have moved to 6 months. Eligibility redeterminations for certain individuals. So most of the beneficiaries receiving coverage through the Medicaid expansion, I just spoke about. So we were talking about work requirements, and now we're talking about the this reevaluation period. So again, that moves from annually to 6 months. The increase in workload, which is double, additional verification task, increases in notices, so you have to mail out the beneficiaries their notice that they're going to be reevaluated, and if verification is not completed timely, say they don't send in what they need to send in to be reevaluated, their case will not terminate. It will just roll over to the next month, and it just sits there until somebody touches it. And every month that they're getting services, and they're not supposed to, it could be an error if when they finally get to it, they were supposed to be disenrolled. Limits on retroactive Medicaid. So effective January 2027, beneficiaries who apply for retroactive Medicaid coverage may only receive up to 1 month Medicaid expansion or 2 months all other Medicaid. Currently, retroactive Medicaid is 3 months. So depending on what program I fit into, my retroactive period is going to be different. So what does that mean for us? It means that caseworkers must evaluate every type of Medicaid, starting with the highest, and then the complex policy and the eligibility criteria will require additional training. So it's different policies, and every little situation is going to make that case different, which is just more work. So that wraps it up for Medicaid. And we'll start talking about SNAP. And again, this is a Supplemental Nutrition Assistant Program. And we'll talk about all these changes in detail. The first is non-citizen SNAP eligibility. Effective February 2026, eliminates SNAP eligibility for certain immigrants who are legally present in the United States, including those who have qualified for conditional entry under asylum or refugee laws. Limits non-citizen eligibility for SNAP to lawful permanent residents, and that's a LPR, and Cuban Haitian entrants and Compact of Free Association migrants. This will impact us by creating new case processing times for recertifications for non-citizens participants due to the SAY verification. And the SAY verification is a system, and correct me, Ms. Monica, that is used to verify U.S. That stands for Citizenship and Immigration Status Documents. So you got to make sure the documents are real. So you have to put them in through this system. And again, that just takes time, and it's a complex policy changes, which is prone to errors, which may lead to erroneous terminations or denials of benefits. Modification to SNAP work requirements for able-bodied adults. effective December 2025. So this one we've already started. Able-bodied adults aged 18 through 64 who do not meet an exemption are subject to the ABOD work requirement and time limits. HR 1 increases the upper age exemption from 54 to 64 and decreases the dependent age, and that's to 14. So if you have a child who's 14 and older, you are expected to do the work requirement. And again, that requirement is 80 hours per month in activities such as employment, training, community service, or volunteering. If not fulfilling the requirement, so if you're not able to do the work requirement, you are limited to 3 months of SNAP eligibility in a 36-month period. This requires thorough screening for our staff and participants for exemptions, increasing case processing times, and potential for errors due to increased policy complexity. Ability of standard utility allowance based on receipt of energy assistance. So effective 2025, it's already started, but prior to HR 1, North Carolina used the HEAT and EAT to automatically confer the heating and cooling standard utility allowance, so the SUA, to any household receiving LEAP, which is a low energy assistance program payment. Now, households with an elderly or disabled member who receive LEAP retain the automatic allowance. All other households must independently qualify for the SAU by demonstrating actual incurred heating and cooling expenses. Households unable to verify these expenses would drop to the basic utility allowance or telephone utility allowance, resulting in reduced SNAP allotments. This will create, we're having to, verification of affected households adds processing time at the application or the recertification, and reported moves. So caseworkers must verify the incurred expense for non-elderly, non-disabled household, and previously, again, that was being done automatically. Now the split allowance rules increases policy complexity, and that is a known driver of quality control errors. Now this is a big one, administrative cost share. Now we're talking about funding. So currently the funding for FNS, food nutrition services, is 50% federal and 50% county. Effective this year, October 1st, that is going to move to federal 25% and county 75%. And we'll get into what those numbers actually look like here in a bit. Another big change is the benefit cost share. So when we talk about benefit cost share, that is the actual amount of funds that is placed on the EBT card. The funds that are being used by the participants for purchasing food. Currently, that is funded 100% federal. That's 100% federal funds. There's no contribution to that. Starting in October 2027, states may be required to pay a portion of the benefit cost share each year based on the SNAP payment error rate, or the PER. According to the error rate in that chart will show how much the county, what percent the county would be responsible for. So if North Carolina as a whole is under 6% of the error rate, that is no cost. Between 6 and 8% error rate, 5% cost. Between 8 and 10 error rate, 10% cost, and anything above a 10% error rate is 15% of the cost. So what is the payment error rate? It's an incorrect benefit determined resulting in an overpayment or an underpayment. It is the total value of the overpayment and underpayments divided by the total value of payments distributed for a given fiscal year, and only rates greater or less than $57 count towards the payment error rate. Payment error rates are driven by unintentional mistakes made at the county client level, with 65% of those being agency error and 35% of those being client error. So North Carolina payments error rate, so we are down at the very bottom where it says 20 states. NC rate is right now, the error rate is 10.21%. That would put us at the highest cost share, 15% cost share. Now, it's important to note that for the fiscal year 2024, while North Carolina was at 10.21%, Sampson was 1 out of 58 counties with the error rate less than 6%. For 2025, the preliminary North Carolina error rate is 7.01. The official rate will not be released until June 2026. It's sounding good because we're right at 7 right now. However, if you go down to the bottom, the goal for 2026 is to be under 6. However, with all these scheduled policy changes, that will be very unlikely because these policy changes and complexity are likely to drive up the payment error rate. For the first year that we have to do the payment error rate, North Carolina is able to choose between the fiscal year 2025 and 2026 error rate. So benefit cost share, key considerations. Benefit cost share is based on the payment error rate for the 3 years prior, except for the first year where North Carolina gets to pick whether to go with 2025 or 2026. After that, it's based on the error rate 3 years prior. So the work that is being done right now will set the error rate for the fiscal year 2028. States do not control SNAP rules. Congress decides who get the benefits and how much they receive. States cannot control how many people enroll in SNAP. During a recession or tough economy, more people are likely to need help, and states could have to pay out more than expected. Since COVID, states have seen a large swing in their error rate. And again, the payment error rate has historically increased when new policy is implemented. If North Carolina cannot pay for increased state benefit cost share, then North Carolina as a whole will have to stop offering the SNAP program completely. Counties cannot opt out individually. It has to be the entire state. So fiscal impact for Sampson County. And these are the numbers. So for administrative cost share impact for us, I have done the columns for the year. So 2024 to 2025, we're at like 1.8 million admin cost, total admin cost. And that is split 50-50 between the county and the state. Sorry, county and the federal government, yes. Now, it's the same thing for fiscal year 2025, 2026, 50-50. You move to fiscal year 2026 and 2027. Because of how the fiscal year is, we calculate federal reimbursement at 31.25%, which is 3 months at 50% and 9 months at 25%, for a total of $613,000. The estimated county share, we're going to do 68.75%. That's 3 months at 50% and 9 months at 75%. It's going to be a total of, projected increase from the previous year is $368,000. So that's a new amount that's got to come out of a county share that we've not had to do any other year. Right. Now moving to 2027, it's going to be $2575, which will put our projected increase from the previous fiscal year to $122,000. And this is administrative cost. Now for the benefit cost share impact. So again, we've never had to pay any of this, so I've listed what the cost share was for 2024, 2025, and 2026. We're using the same number to estimate 2027. If North Carolina is less than 6%, zero cost share. Between 6 and 8%, we're looking at $1 million. Between 8 and 10, $2.1 million, and over 10, $3.26 million. There's some big numbers. This is a timeline of all the changes we discussed. The ones in red have already occurred in 2025. The ones in purple are this year, 2026, and the ones in blue are the ones to come in 2027. So final thoughts and takeaways. Again, Medicaid and SNAP are entitlement programs. So we can't control who applies, how many people receive, the policy is what the policy is. We cannot control eligibility. Congress decides who gets the benefits and how much they receive. The payment error rates have historically increased when new policy is implemented. And the policy does not align between Medicaid exemptions and SNAP exemptions. So it's not the same across both programs. And social services work will continue to increase due to twice-yearly recertification periods, complex policy changes, eligibility driving enrollment and disenrollment, and increased processing times. That was a lot. Do we have any questions?
I assume that the cost share thing for SNAP, if the error is 15%, you have to, or over 10%, you have to pay 15%.
Yes.
Between 8% and 10%, you pay 10%. Is to try to drive the counties, since the counties are the most likely place for errors to occur. The federal government's trying to make sure the counties do a better job of preventing error. That's the idea behind this.
Yes.
I would be speculating if I would to comment on the idea behind the big beautiful bill. So
In theory, that's why they did this.
In theory.
Yeah, I'm just trying to.
And I would like to share, we're at 0% right now.
Ma'am?
Sampson County is at 0% right now.
So not only are we less than 6%, we're at 0%.
We're
Carry on.
desperate to the state of North Carolina.
Yes. Yeah.
But we got to pay because of,
And it's my understanding that it's about 15 counties that their error rate really drives the error rate for the whole state. And Sampson is not one of them.
And it's your more populated county.
It's your more populated counties.
bigger counties.
And what would it, I mean, if the state of North Carolina opted out, I mean, that would be devastating to the local economy, wouldn't it?
Yes.
Yes.
I know at one time you could monitor Medicaid, drugstores and physicians that receive Medicaid payments and how it contributes to the economy locally. You still have that capability?
I'm not
We
aware
don't,
of
but the
that.
state does.
The state has a program.
We don't.
You have the same capability for SNAP benefits of seeing just how it contributes to the local grocery
This,
stores?
I have seen some PowerPoints with numbers from the state. I can share this.
So the cost share is not going to be an issue for the next fiscal year,
2027.
2027. But the administrative cost share will be an issue for this coming year.
Yes.
Projected at 368,000.
You were speaking about the people that we got quit. Can you imagine what's gonna happen now when they come into all this work? It's 3 times as much work
Extra.
as it was, and they want to quit.
Yeah.
So now that they're getting extra work,
I can tell you it's a lot on staff, but that flex schedule helps some because when they work from home, they don't have those distractions.
yeah.
And they can get more done. So our people that do flex schedule, they're still required to come into the agency at least once a week because we want to keep that connection.
Yeah, that's good.
That's a good thing.
That's good.
And you have any way of estimating what you think the state's cost share could be as a whole in 2027? It's kind of a...
It depends on the error rate.
And it's not looking good with all the policy changes because we know that's a driver of errors.
So it's highly likely that in 2027, we could be judged on over 10%.
That is a worst case scenario.
15% cost share.
That's all.
Any other questions for members?
Thank you.
You're welcome.
Thank you. And moving down the agenda, board members, we're to 7F. So now we want to hear from Ms. Wanda Robinson and Health Director and her team related to the big beautiful bill impacts as well.
Is it arrow?
Yeah, I think the arrow.
This one? Okay. What? Oops, okay. History. So I guess we're going to get started. I think everybody knows me. And my partner here is Tamara Jones, and she's the accounting specialist at the health department. She's the one that manages the money for us and does a really good job of that. So we're going to jump right in. Good afternoon, everybody. Hope everybody's doing well. We're going to try to walk through the differences, impact it's going to have on public health. There will be some impacts for us. We hope it's not going to be as bad as well. We just hope it will not be that bad. So, but it's called the Big Reefer Bill, which, and we're trying to talk about two things today of how it's going to impact us. We're going to look at our health department revenue sources. Then we're going to look at the issues that we may have from the CDC side, and then we're going to look at the issues that we may have from Medicaid reductions. So those are the two impacts that we may see as this comes about. Revenues, I'll let Tamara explain this because she does a better job than I do.
What this is showing, we looked at fiscal year 24-25 of our patient base that came in during that time. And during that time, 47% of our patients were patient pay. So they didn't have Medicaid, didn't have insurance, didn't have Medicare. They had to pay for their services. Of that 47%, which was a total of 1,732 patients, 54% of those slid to zero, which is 1,611. So the majority of our patient pay patients do slide to zero. Now, that could be they're in for STD services, which we can't charge them for, regardless of their income. It could be for family planning, and we do stuff on a sliding fee scale, which is based on the number in your household plus the household income. For instance, a household of 4 who had an income between $45,000 and $57,000 would be a 40% pay. So that's how it levels out, and we go all the way up to 12 in the household. If they made 33% or less, 33,000 or less, they're at zero.
Okay.
Our next slide, we wanted to kind of give you an idea. These are actual, from our agreement addendum, this is the funding that we have been promised for this fiscal year that will start in July. So this is our state appropriations, and I'll let Tamara explain that to you also.
The ones in red are reductions in what the state has allocated for us. The ones highlighted in green, we actually have the agreement addendums at this time. The only one we're missing is WIC, breastfeeding peer counseling. I'm erring on the side of they're going to give us the same amount as last year because I don't know. We may not find out until May what they're going to give us. But we have an overall decrease of $80,788. Now, $22,993 of that are in Agreement Addendum 121 and 914, which are ARPA funds that carried over from COVID. So this is the last year we got those. So that wasn't usually a factor in our budget anyway. It was an add-on.
Any questions about those?
Can I ask, wasn't this the information where we said we basically gathered that the overall impact would be about $114,000?
This plus the Medicaid reductions.
Plus the Medicaid.
Yes. And they've got copies of both of those.
Okay, sorry, didn't mean to get ahead.
No, that's fine. No.
So we're going to move right along. So let's look from the CDC side. We've been in news quite a bit lately. Proposed funding for fiscal year 2026. This has been proposed is that funding would be cut approximately 40 to 53% as opposed to 2024. Programs that they're thinking about eliminating or that they look very closely at is chronic disease, diabetes, heart disease, HIV and AIDS prevention. Those would not be very good if that happens. So emergency preparedness, 52% reduction. And this is where we have to go out and respond to outbreaks, disasters, and those kinds of things. And as you all know, we do have a measles outbreak now that right now we've had maybe 2 in Johnson County. Not gotten to Sampson County yet, but should that happen, that means we've got to get out there and be prepared to respond. So that's fun. That's that funding. Data integrity. This is where all of our vaccine information, such as we have a measles dashboard now that shows us cases of measles throughout the United States and that kind of thing. Some of those may be paused or are going dark. So we are losing some of those databases already. So, and these are things that has just happened. So this is not all of it. Other programs that will be impacted that we know of, immunizations, TB prevention and cessation, school health services, which we hope they don't, maternal health, because all that funding that we were looking at right now comes from the CDC side. So we get hit from both sides, CDC and Medicaid. Centers for Disease Control, 2026, we've had our number of vaccines to be reduced from 17 to 11. This is concerning to us. As you can see now, we have what's called shared clinical decision making. Anytime we give vaccines now, we are to talk with that parent, let them know the cost, benefits, side effects, and all those kinds of things. And they make that decision as if they want that vaccine or not. So even though we do have research to show that the vaccines are very effective. Hep A and Hep B, especially in children, those are one of the recommendations that have been reduced from 2 to 3 doses, and that's at mom's decision. And the reason that we don't want those recommendations completely cut out, because if the recommendations are not in there, we cannot be a third party pay us. Insurances will not pay for those vaccines. So these are the ones that are really on the cutting block right now. Reductions, and this is just the funding history. I wanted you to kind of see what the recommendations were for the past couple of years, from 2019-20 to now, to see how Medicaid has gone up. And now we're trying to come back down, 24-25. We do have case management and some other things in place that are trying to help with those reductions for Medicaid. Medicaid rate reductions and reversals. In October of 25, there is a $319 million funding gap shortfall in North Carolina. NCDHHS was forced to reduce Medicaid by 3% to 10%. That reversal did occur December 10th. And then the governor decided, well, we're going to go back and put that back in. So that happened. So this is what could have happened. Now that Tamara explained that, this is what could have happened this fiscal year.
So we pulled the numbers from 24-25, and that's our actual revenue that we received for the programs from Medicaid on the first column in the left. Anticipating a possibility projected reduction of 3% for those programs is at $25,156.11 reduction. And then family planning, a projected reduction of 8%, which is $91.83, which is overall $31,409. And if you combine this total with the $80,000 from our agreement addendums, we're looking at about $122,000 deficit between possible projected Medicaid reductions and our actual state reductions that we know about already.
And it's a bit busy, but I just wanted to kind of show you that when we start reducing the number of Medicaid clients in our county, for the health side, you start looking at it threatens Medicaid, it is covering coverage issues, reduce access to care. That is our big concern, reduce access to care. And then the greater strain that it's gonna put on our providers and local agencies. Medicaid doesn't pay us 100%. And that's the other piece. And their reimbursement rate is a lot lower than what the private providers get, or what the providers can get from other third-party billers. So We're already at a midpoint to where it's causing us issues, but if it's reduced any further, it's just going to cause issues because providers can say, no, I'm not going to see Medicaid and not see them in their offices. So what happens? This is the policy changes in that, and I did mention, of course, Patty has already talked about this, but it looks like eligibility and enrollment changes are projected to cause 17 million Americans to lose health coverage. And that is scary. I would hate to see the day that I don't have some kind of health coverage. Those actions in response to HR 1 is going to make it harder for Medicaid enrollees to access and afford care, and that's from one gamut to another. I've been down this road before, and I hate this. But it is going to cause increasing the burdens on providers, especially safety net providers. And the health department is a safety net provider in that we are the only agency that you can come to. We will put you on a sliding fee scale. And if you don't have the money for certain programs, we will see you. That's what we are there for. But this is really going to put an extra burden on us as we provide services in the health department. Medicare reimbursement is historically lower than other payers, and it says safety net providers like community health centers rely on Medicaid for 40% of the revenue, so lower rates will strain us. People will start going back to the emergency rooms and those kinds of things. So I'm sure the hospital is going to see this impact just as much as we are. So therein lies the healthcare system, and we start having cuts of 3% and 10%. We showed you a few minutes ago what those cuts could amount to, and per agency or per whatever. So really important. So budget timelines, we just kind of gave you an estimation. Our state budget, like we just said, we have received our funding levels for February. We received them this month for February 26th for next fiscal year, effective October 1st, 26th. That's when we will see the other side for us Medicaid and CDC and some of the other things, because their funding year is different from what the county's funding year is. So we won't know. We will not even know until September of this year what the actual cost will be, or what cuts as far as CDC and Medicaid. But as people are taking off Medicaid, the systems, there will be that back where they will start looking for care otherwise, which is going to impact us as a county, from us, private providers, to the hospital. So.
Did I see on there that chronic diseases are going to be eliminated?
Some of the programs that offer preventative health care will be decreased or cut back.
Cancer treatment?
Some of the cancer treatment, research and those kinds of things. If you listen to the news now and what some of the DHS is saying, some of the things that's being put out there, vaccine is our concern. I would hate to see the day that they decrease our vaccine budget, because that's where we get our funding for children 0 to 18 years of age. It's from CDC. So CDC is partially funding health departments on a local level.
That's scary. Really scary.
I saw measles was eliminated at one time, I remember many years ago, and it's kind of strange to see it come back again, but it's because we worked so hard. And right now in our school system, we are 100% vaccine rates as far as children getting their shots and stuff before they go into the system. And that is excellent. We're one of the counties that have done really well with that. But I would hate to see the day those things are cut.
Are you communicating with the hospitals and everything as far as the impact it's going to have on rural health care? I know that they've worked hard on trying to get some providers throughout the county, and with Medicaid being impacted, will that have an impact on our hospital system here? What kind of impact do you project it will have?
So I can think of one program in particular, maternal health. You know, right now we don't have a full-time OBGYN here in this county. They're contract or locums. And that has had a very, we're having to see low risk and referring out the county for folks to receive care, because when they get there, they don't have anybody to see them. And if rates continue to go down, then that's going to make a difference. But we are in contact with Mr. Howerton in trying to work through providers. Providers going to work with see our patients, get our clients over there, deliver, and those kinds of things. So that's where the impacts are going to come in as rates go down. He said, people are not going to have access to care. But there is a grant that's come that we are able to apply for, and it's called, can't remember, I lost it. The Rural Health Grant. The Rural Health Grant. There's over $319 million or so that's going to be available for the state of North Carolina, and there's 5 or 6 regions where we can apply for part of that funding, and we can apply for health care. And I do hope to meet with Howerton to make sure that we can get some of that funding for health care and across the
and not put you on the spot, but Ms. Wanda, will you explain to the board kind of how that grant is set up?
And this is to also help that crossover from changes in Medicaid to kind of help rural counties, because y'all know we have such issues with healthcare in the rural counties. So it's set up to where it's going to be a big grant for the state of North Carolina. There are going to be 5 different regions, and in those regions you're going to have hubs where the counties will work within their hubs to make those applications to apply for that money. So there will be a certain amount, I think, that's going to be set aside for each county that we can apply for that will help us with healthcare services. So hopefully we can get that up and going. Applications are being submitted now for different, like our county, there's about 8 or 9 counties, and one of those counties would be the hub, and then we would all feed into that hub. I don't think we would want to be a hub because that's where all the funding would be.
It's intense.
Yeah, it's very, very, I don't think, but once that hub has been set up, and hopefully we can apply for our pot of money, and I'm going to say our pot of money, but our pot of money for Sampson County.
You know how that's going to be based as far as the pool?
Probably population. A lot of times it's population based for public health.
Kind of feels it's going to be how many people went into your facility and used it, but I would think it'd just be population.
It's going to be population based, I think. So usually that's what our funding is based on.
Okay.
So hopefully we can apply for that. And Mr. Howerton has been very good to work with when we are trying to access services and provide services. Very good to work with. So.
Okay, that'll help. Thank you.
All right, thank you both. Commissioners, I'm going to ask if you will go to 7G back to the original presentation and on the agenda. And that would actually be, just to get you back on track with the original presentation, it would be slide number 23, which is on page 12. It says economic development. Yep. So, with that said, Mr. Ray Jordan, will you please come up, our Economic Development Director extraordinaire. And we appreciate all of Mr. Jordan's efforts, and we just realized...
If we could, the commissioners would like to take a 2 or 3 minute break between real quick.
I want to go outside and warm up.
Oh, yeah, you want to take a straight break or whatever, right now is a good time to do it.
Everybody else is cold.
Y'all ready? Yeah, we're back live.
All right, thank you, Commissioners. Well, Ray just told me when he sat down, he says, I'm here to solve your problems. So all joking aside, though, we do talk about, just like the screen says up there, growing the tax base. After hearing all of these various impacts and things that we're faced with, there's no denying it would certainly be helpful to grow that tax base. And And certainly economic development does it in a way that it helps relieve the burden off your residential taxpayers. So anyway, with all that said though, I'm going to go ahead and turn it over to Mr. Ray Jordan, our Economic Development Director.
Good evening, Commissioners, and thank you for the opportunity. I'd first like to go back and reference page 4 of your initial thing, and Mr. Van went over it, that the Economic Development Department should make a recommendation to the county manager, and that's what this is about tonight. So in your packets, you were shared with a 8-page document that's got a lot of wording and writing on it, a lot of details. I have tried to take that and condense it down as best possible, but as you can understand, this is a lot of information to share. I'd like to begin with an overview of our project activity and how we receive projects that consider our state, our region, or our county come through what we call request for information. They generated typically through EDP&C. In our case, through the NC Southeast Partnership, they can come direct from a realtor, a consultant, or direct from a company. So I just wanted to provide that as oversight as I begin. So like I said, you've been provided with this detail, and my talk here is going to be a little bit off of, it's not going to follow in a direct line with that, but it will cover all the points. Between September 2023 and February 2026, our department has received 281 requests for information for companies evaluating locations for new facilities in North Carolina. These inquiries have represent a significant potential economic opportunity for our state and more especially our county once we can land those projects. Within these RFIs, there are key indicators of what these companies are looking for. When these requests come in, they can be, I've worked on them when Stephen was here, as many as 200 questions that these companies will have of us. But they do provide us some initial data to start with. What we're trying to do is to avoid being eliminated from the search process. But within this RFI, the key indicators that I'd like to share with you of the data collected. The average, now there's 281 projects, remember, that have been considered. The average capital investment on average was $226 million per project. The median capital investment represents $40 million per investment. The average number of jobs created would be 227. In your report, there's more details and drill down a little deeper than what I'm covering. This data reflects that there is strong demand for industrial space and development-ready sites with continued interest across manufacturing of both heavy and light, logistics, agribusiness, and technology-related industries. This data provides us with a roadmap for what modern industry requires to locate in communities like ours. Industrial building demand. One of the strongest trends in the data for existing buildings is that there's of those projects, 144 of the 281 were looking at an existing building. Now, if you combine that back with the number that would consider a site but prefer a building, that number would be higher. So some of them say, well, I want a building. If I can't find one, I'll consider something else. In most cases, those are larger projects that are looking at larger tracts of land. And I'll talk about our land in a moment. So the median building size requested ranges from 70 to 105,000 square feet. The reason for the range is they ask for a minimum of what they need, and they talk about what they'd really like to have somewhere in between. That's the reason for the range. Based on overall demand, the ideal size of our averages would be a 120,000 square foot building. However, a realistic and strategic first step would be for the construction of a 60,000 square foot speculative or shell building designed so that it can be expanded to 120,000 square feet if and as needed. With that, recommended initial building specifications would include the construction of a 60,000, I'm using 60,000 as an example, square foot footprint, basically a 200 by 300 foot building with 30 to 32 foot ceiling heights, expandable design that can be knock out one wall, move it to the end, add 10, 20, 50 more thousand square feet. 3,000 square foot of office space, dock doors and drive-in doors, with an insulation package that can support future HVAC installation. 400 amp electrical service for basic lighting just to get until you get a client in. Consideration of installation for sprinkler riser inserts so that you don't have to go back and cut your footers out, and high bay lighting. These features align with what modern industrial expectations for a building look like in a competitive environment. Currently, Sampson County only has 2 industrial buildings, and both are classified as Class C facilities. A Class C building is typically 30-plus years old, has limited modern features, outdated infrastructure, and often requires significant renovation, and are typically used for storage or light industrial activity and have very low ceiling heights in most cases. So our 2 buildings, one is the former Garland Shirt Factory, 11-foot ceiling, 88,000 square feet, and then there's another one that's landlocked at 67,000, but still has relatively low ceiling heights. Those are the only 2 that we have available listed on our website. In short, with that, what that says is we lack market-ready industrial buildings that companies can immediately occupy. Now, going on with what companies are looking for, the data shows us related to infrastructure. Water demand it's going to take a lot of water for projects. Water demands for the projects from the 281 projects average from a company needing 1,000 gallons per day up to 3 million gallons per day, with the median being 280,000. So when you think about that, City of Clinton, as an example, the largest utility as far as water and sewer infrastructure that supply an industrial park in Clinton, only has 1.5 million gallons of excess capacity. And that would be if they receive water and the company would be sending them back basically domestic water. Nothing with any sort of industrial because of the the things that are coming back already to their sewage treatment plant. So that 1.5 million sounds a lot, but when you look at the median average, daily demand is 280, it's really not. So sewer demand is almost mirrors that identically. And these levels highlight the importance of communities having strong water and wastewater capacity to support industrial growth. Now, there are sewage treatment facilities in Garland, Roseboro, and Newton Grove, and Clinton, and that's pretty much where we have wastewater treatment. And all of those have limited capacities. Natural gas demand of the 281 projects that we received, 146 projects required natural gas. 39 did not, and 96 were to be determined, or they didn't state that. Natural gas continues to be a significant competitive advantage for industrial building. Bless you. Electrical infrastructure. Electric demand across the projects range from 0.25 megawatts up to 100 megawatts. This reflects a diversity of industry types, including food processing, manufacturing, advanced manufacturing, distribution, and data-intensive operations. So, used to be water and sewer was the key. Now, electricity is going to be a larger player going forward with all projects. So reliable electric infrastructure is now considered one of the most critical for site companies to locate. As an example, right now today in Clinton, Clinton Park has roughly 5 to 6 megawatts of power available, excess power. Now that could be going tomorrow with one project. And the reason I point that out is on a recent inquiry, we asked of Duke Energy if we were to have, we had a company we were trying to see if we could submit for. So we asked the question, if we took down the 4 megawatts off the grid, so to speak, how long would it take you to replace or go, well, the company actually needed to get the 10. 36 to 42 months. So that was what they sent back to us, and at that point, we could not meet the timeline of the company. So they're saying by this date and time, we got to have 10 megawatts of power. Duke Energy is telling us it's going to take this long to do it. All right, and stop me anywhere if you like. I'll be glad to entertain your questions. Broadband requirements. Nearly every single project indicated broadband needs, and the majority required 1 gigawatt broadband connectivity. And these companies require high-speed, reliable internet for operations, logistics, automation, and communications. Moving on to transportation infrastructure. Transportation access continues to play a major role in site selection. So I'm going to start with rail. Now, we do not currently have a rail site in Sampson County. We're working with the city of Clinton to potentially bring back the former Hamilton Beach property, which is relatively small, but at least it would give us access to rail. Along the rail line that's in Sampson County, we've not had any success working with any landowners who would be willing to part with it. And I'm going to say at any price because no one would give me a price on it. But 26 required rail, 36 preferred rail, and 114 we're still evaluating. But this means a major advantage is rail, but it's not always mandatory. So it helps, but it's not a hindrance. Highway and airport access. So when we look at this, we've had the tagline for a long time, perfectly positioned. And we are in many ways. When Highway 24 opened at 4-lane, that made a big difference on 4-lane access for Sampson Southeastern Business Park. But of the projects, 4-lane highway within 10 miles, 23 projects stated that was a gotta have. Interstate access, and I put the range of 5 to 30 miles because they were all over the place, but that was the range. 73 of the projects expect that. The thing with that is, I'll highlight a little bit later, the Joe Britt Warren part is sitting on I-40, and it's only 18 minutes from I-95. So you got 2 interstate intersections. So their international airport, this becomes, there's 36 projects that stated that was a need to be within 100 miles because of what they were shipping in or out by air, primarily. There was one specific project that needed to be within a certain distance to a FedEx hub, which, that was a bigger project. But I'm trying to paint a picture of how these things come across. So Sampson County's proximity to regional highways and major airports remains a strong asset in marketing the county, especially at the Joe Britt Warren site in Newton Grove. So now I want to talk a little bit about regional competitive landscape. Within eastern North Carolina, there's a significant shortage of modern industrial buildings. According to the North Carolina Southeast Regional Shell Building Report in May of 25, of the 25 counties that are members of our region, 12 counties have an active shell building program, and 8 counties have no programs or projects, and we're one of the 8. This means that communities that construct speculative industrial buildings are significantly more competitive for industrial recruitment. Now, why building a spec building matters. Many companies, and I want to stop here and share with you, 144 of the projects of the 281 were seeking a location that because they did not want to wait, speed to market, and the length of time it takes to build a building. Now, we could say, why don't they plan better? That's just the way the business is rolling. But this is what the trends are showing. Because of this, companies often choose communities where a building already exists. A spec building dramatically shortens the recruitment timelines, and communities with available buildings more often win. Constructing a speculative shell building or spec building will better position Sampson County to compete at a higher level. Now, next, I want to change gears a little bit and talk about potential tax base impact. As you're well aware, industrial investment can significantly expand the non-residential tax base. Again, I'm going to talk backwards a little bit. Projects responding, again, capital investment averaged to 226 million. The median was 40 million and 227 jobs per project. Even securing one project of this scale could produce substantial long-term property tax revenue, create job opportunities, and result in other positive economic activity for the county through wages and ancillary businesses that come across. But in your packet on page 6, I want to share this with you. You'll find a graph, or chart, that shows capital investments ranging from 10 million to 150 million. And I call your attention to the yellow line that says $103 million. So a project at the current tax rate of 68.5 would generate $705,550, which is slightly above the value of a penny. So what we're saying here is that's what it's going to take to generate 1 penny on a tax rate. $103 million project to create 1 penny. Now, you can see by the numbers there above what points generate, the points of the penny it's creating along the line. I appreciate Melissa helping me out with this chart. The second chart is especially something that I've shared with you before, but I want to just go over for those in the audience as well. In our county, we currently fund our schools at $1,483, Melissa?
Yes.
$1,483. Now, on the second chart, gentlemen and ladies, the blue line is the median home value. That's the period covering 19 to 23, which represents the most recent data I could get my hands on. That's the median home value in Sampson County. At that tax rate, that home would generate $879.54 in property tax. If that home has one student in the school system, not counting other funding sources, that means that our county loses $603 on that one household without any other county service being touched. Now, if you go down a little further from information provided by the tax office, that value comes up, average value, to $157,000, which is maybe a little more realistic given the market value today, of 68.5 cents, $1,077. We're still at a $405 loss by funding one student. Now, if you jump over to the second column, if they have 2 children, we're now at $1,888 loss. But now the bottom line reflects the break-even point. A home value, the value of a home would have to exceed $220,000 to break even for the county. Now, I understand that's before any other service is provided to the county. So I know y'all aware of that. I just wanted to kind of drive that point home. So next, I want to discuss some strategic development areas for your consideration. Sampson County has 2 major industrial development opportunities. The Sampson Southeastern Business Center, which is located in Clinton, in which the county purchased 120 acres of land in October 2020. Upon buying that park, or purchasing that 120 acres, we received a $1 million grant from the Industrial Development Fund of North Carolina, and we extended water and sewer, got all the infrastructure in place, and actually inserted a road into the largest tract of 3 at 67 acres. So in this current space, we do have water, sewer, electricity, natural gas, broadband, and road access. And the sites within here are well positioned for speculative building. Now, but I also want to point out that there's only 43 additional acres of land available in that park, which is currently owned by a landowner in the county. And recently approached the family about that for something that we're trying to work another project on, and would not even budge on, not budge is the wrong word, would not even obligate to a price to say I would take $10,000 or $100,000 an acre. Just, we're not interested in selling it. So the next thing is I'm going to discuss with you about is the addition. In addition, we have the Joe Britt Warren Park in Newton Grove, which was purchased in December of 2022. This site has approximately 210 acres that is planned for development with potential for both industrial and commercial investment, highway commercial investment. The next steps for that park include additional planning, design, engineering, followed by construction. And that would include water and sewer extensions, both on-site and off-site, internal roadways, stormwater management, site grading, utility coordination, site prep, and then construction, as I said, of the infrastructure both on and off the site. Now, we know that this park to be developed is our next future, is the future. So we got to figure a way, how do we do it in a phased approach? And that's what we're working on now. We've placed out for bid, we have out currently a request for qualifications from firms to help us, where we can interview, that can help us take the existing work that has been done and try to figure out a phased approach to this development, and then how we can accomplish it. And then also at the same time, how can we find potential outside sources to help through grant or whatever, state funding, whatever opportunities may arise to fund the development of this park over time. This park will not happen overnight. Now, the key though is to keep it moving, not let it die on the vine. So us beginning to work and complete engineering design will better position the county to pursue state and federal grants, as I said just a second ago. And estimated, now I'm going to jump back a second, and estimated cost of a shell building. So when we started this work, we've kind of had to work quickly assembling this for you. So understand these are preliminary cost estimates, and we're trying to get a contractor to give us some information that would be maybe more reliable, but we feel that this is a pretty good range. The low side was $50 a square foot. The other quote, verbal comment was about $83 per square foot. So we used an average for this scenario of $66.50 per square foot for projected cost. You'll note that there's multiple building sizes included in your information. So for the audience, we've proposed here options for you to look at, depending on what funding may come or may be available. We have a building size of 40,000 square feet would be $2.6 million. A 50,000 would be $3.3 million. 60,000 square feet, $3.9 million, and 70,000 square feet, $4.6 million. Now, I want to remind you that if you look at the median data, through the RFIs, it would suggest that a 70,000 square foot building would be the most in demand. If I had unlimited funds, I would go build a 120,000 square foot building tomorrow. And I feel like we'd get traction pretty quickly on it. But we got to start small, we got to start somewhere. So I'm going to continue on. But what I'd really like to see for you to consider, and what I think long-term would best position the county, is if we look at a combined strategic approach to how we fund economic development across the county. Now, understand there's other areas, we got to try to serve them all, but we got to focus on what we already have. We're working in all across the county, but we got to look, right now we got investments huge in two places. One strategy is the combining the construction of a spec building along with the necessary design and engineering work to move the Joe Britt Warren site forward. As an example, we could build a shell building in Clinton. We could continue funding and work to move the design and there's so much design and engineering that's got to go into development of a site but we'd like to do both at the same time, if there's any way possible. This would significantly allow the county to advance both parks simultaneously. And so with that, just for now in your notes, you've got multiple comparisons, but for this, I just chose out the 70,000 square foot building. If you take building at 70,000 at 4.6 million, add in $1 million for Joe Britt Warren for continued work there, that would be a total of $5.65 million. Now, this approach would be a multi-pronged approach that would position our county for long-term growth. Constructing a 40 to 70,000 square foot building at Clinton, continuing engineering, and preparing both sites for future development. In closing, the data that we collect and have collected clearly demonstrates that there is strong national interest in industrial investment. Companies are actively searching for ready and available sites and buildings, and that Sampson County has valuable assets but must continue in prepping both sites to remain competitive over the long term. By investing strategically in infrastructure and in speculative buildings, we can attract new industry, work to create quality jobs for residents, increase non-residential tax base, and strengthen the broader economic and strengthen in the long-term economic prosperity for our residents. I'm happy to answer any questions, but before I take your questions, I will say I shared with Mr. Van and some others that you always think you're getting the goalpost. But one thing that's really come to realization with me lately with this position is that there are no goalposts with economic development. It will never stop. We will never, if we stop, we're just getting behind. So that's what I had to share with you. I know there's a lot more great detail here, and I'll be glad to answer any questions that you have. And we're glad to have the opportunity to present this.
Ray, will you also remind the board as far as what you were telling me about the last big win we had?
Yes, sir, I will. So last week, Mr. Van contacted me, and Congressman Murphy's office had reached out about potential grant opportunity. And I felt like what we had to provide just for one phone call was a whole RFI response. But essentially, one of the things that we highlighted in there is the need for funding from the federal level for Sampson County and other counties. Listen, we're not the only one in this shape by any means, but our so I'll backtrack a little further. In 2008, we were recruiting a company called FiberWatt. I don't know if you remember or recall that project. It was a project that from the United Kingdom that took turkey litter and turned it into electricity, and they did the same thing in Europe. And they were looking here, and about the time that project was in its stride was when Carolina Power and Light Company and Duke Energy were in the process of merging. And at the time, there was a lot of emphasis from state and other regulators and federal about the amount of renewable energy credits or consumption of green power from swine and turkey business. And so that kind of got locked up into the point that so it stalled the project. But again, this is a long story, but I'm trying to shorten it. But so at the time, the county commissioner made a commitment to buy roughly 250 acres at I-40 and 403. That was in 2008. So in 2010 is when and that company was actually paying some options on it. And we bought it to sell to them because we didn't have anything. At the time, we didn't have 1 acre of land that we controlled, either through an option or direct ownership. So jump forward to 2010 is when, shortly after we were started to market again, is when the Enviva project came along. So in 2012, Enviva announced their investment of $117 million with a commitment to create 39 jobs. Now, that project announced in 2012 and currently has 109 employees with a average salary. they're privately held companies, so they're very secretive about their salary, but I'll say they're $20,000 above the county average. So that's 60 at 109 jobs. They are currently in the top 10 taxpayers with 117 roughly $1 million of investment. Correct, Jim? The reason for sharing this with you is that our last major industrial announcement, basically our only major industrial announcement, occurred in 2012. And now we've had some little small things in between, but those are projects that move the needle, and they've created some very good paying jobs. And I guess the main takeaway from that is well, I will back up and tell you, when the commissioners purchased the land, they were slammed in the media. No offense to the media, but by the public. Why are you buying this land? Well, then they bought it, and then it didn't go through. Well, they called it again. But we would not have had that project had we not had that land.
That's right.
So making these investments in the future are critical. And my job's here to advocate for it and work at your pleasure. So, I'm here to answer any other questions.
You said that Joe Britt Warren is 210 acres of county-owned land.
Yes, sir.
How much is the Clinton Industrial Park county-owned land?
It's 120 acres.
That's actually county-owned?
Yes, sir.
Okay. 120 acres?
Yes, sir. There's a 20-acre parcel, a 17-acre parcel, and a 67-acre parcel.
3 parcels.
So you would propose building a spec building in Clinton?
Yes, sir. Well, if we had the infrastructure in Newton Grove, I would be advocating for that. But currently, we don't have. It's going to take some more time for the development of these plans and what it's going to cost, and then how do we seek infrastructure grants, water, sewer. But currently, there's not enough. There's capacity to get started, but we don't have a road into it yet.
Is there ever requests for just pad-ready sites without the building?
There are, and that's another thing that can greatly enhance your ability to connect with a client. With a shovel-ready site, the EDPNC or NC Commerce has guidance for that, what all that entails. And there are things that we've yet to, I'm not saying we haven't investigated them because we've looked into it, but we've not, there's a lot of additional due diligence that we've got to do even to do that, because before even construction. So you kind of got to understand, you've got to understand what building you may build there so that you know what the footprint would be. But a pad-ready site would essentially be foundation ready. And that would be a tremendous help, just having that. But again, going back to the number of RFIs that are looking at existing building, if we're trying to look at long-term and short-term, should we consider trying to create a short-term win as well, get on base?
Could you speak to some of the successes down in Bladen County that you're familiar with?
Yes, sir. So Bladen County has a very good program. Chuck Huston's, I've worked with Chuck ever since he's been there over time. And they also have they're a unique situation. They're a nonprofit. They have what's called Bladen's Blooming. They have a significant war chest of money, about $4.5 million sitting in the bank at their disposal. When they started 20 years ago, now keep that year mark in mind. They started with one small building that was about 12,000 square feet. And the first tenant in didn't want to buy it, so they leased it to them. So then they began to get revenue, and they scrapped up and saved enough money to build the next building. And when that client said, well, I'll lease it. Well, they were able to offer below market rates, make their payments, because they're not interested in, quote, making money. They're just trying to create the jobs and investment to keep the tax base growing. So through that, they've extended and got some great projects. And I'm frequently asked out in the public, why aren't you doing what Bladen County's doing? Well, they're 20 years in and they're well funded. And as a plus, they don't have to deal with a lot of red tape that we have to deal with being government. They can go out and make a decision and not have to go through 16 public hearings and all the things that we have to do sometimes. And as I say that lightheartedly, but you can understand this. I mean, if they want to be more nimble, they can be. But they've been very, very successful, and they're actually now, there's a subdivision or housing going to be adjacent to it because they've had a large focus on workforce outlook. And they've done a fantastic job. They really have. And I'll be glad to, I would be glad to put together some tours if you're interested in going to look at Bladen. If you're want to go look at some of the other counties that are doing spec buildings, our neighbors just this side of us, Duplin County, currently have two 50,000 square foot buildings that they're finishing up, and Wayne County. Harnett County is in a unique position. They allocated a considerable amount of money for economic development, and they were able to partner with Samet and to build a very nice Class A building, which will be pharmaceutical grade when they get done with it. Now, I'm often asked about partnering in grants and such. There are opportunities for all of these, and oftentimes not often, in most cases I don't have the necessary documentation through engineering, some level, to be able to even adequately apply for a grant. So for Newton Grove, when we go to talk to somebody about water and infrastructure, they want to know what it's going to cost. We don't even know that yet, so until we continue this work. But just prior to Stephen leaving, when he and I were working closely together, Barrington, and everyone knows Stephen, I guess, we did approach ARCO and we approached Samet, who are two of the largest spec builders in the state, and they both came down and visited our community. And at the time, we were showing them both the Clinton Park and the Newton Grove Park, and they were both very polite with what they were saying regarding Clinton. And they typically build stand-up wall buildings, which are concrete construction, tilt-up wall, and that's what they build. That's what they put their money in. And the Clinton Park is primarily metal buildings, so they said that's not a fit for us. We took them to Newton Grove, and basically the response was, when you get infrastructure ready, call us, we'd love to talk to you. But the infrastructure is the issue.
Have we ever contacted the Amazon distribution center? They're very popular.
They are. I would retire if we could get the one that just announced in Wilmington, because there'd be no way to beat it again.
21, that's
So, yes, unfortunately, the land space and the infrastructure, we don't have any. I mean, I'm not going to say it would never be a possibility, because it could be, but currently we don't have the space or capacity for it. That building on 421 in Wilmington is 5 stories. I can't remember the square footage. It's huge. And
Pender County.
Yes, Pender County. I'm sorry. And they're going to have 3,000 employees. Now, I'll close with this. Recently, there was an announcement in Benson. Vulcan Elements, if you may all have seen that announcement, was over $1 billion investment, creating 1,000 jobs with $86,400 average salary. And the reason I share that is we're going to get the overflow from that. Whether we want it or not, we're going to get the housing from those people that are going to be living in that area. So that's going to have an impact on that. And when I left their grand opening, or when they announced the project, I clicked the odometer on my truck. It's 18 minutes to our industrial park. They are going to need others to supply them. So, there's good opportunity if we can get positioned. And there's limiting places to go in Johnston County. Harnett has available, and they're building a building now, 130,000 square foot building. It'll be a great building for them. But I will tell you that the building that Vulcan has taken down it sat 2 years before it was sold. But now, by the owner's words out of his mouth to me, who built the building, who was a speculator in this case, he said, we waited for the right project. They just didn't settle for what came along. I've talked a lot. Any other
questions, board members?
I'm good right now.
Well, thank you.
Thank you, Ray.
Thank you, Ray. So board members, we don't have too much further to go here. If we look at, just to bounce back to the original presentation, you need to go to slide 25, which is on page 13, I believe is what you would have. So just want to talk a moment. This is kind of bringing everything back full circle and to try to wrap everything up. So the potential budget impacts, as we're calling it, that we've talked about are the 3% COLA and $500 bonus per full-time equivalent employee, which is $1.5 million. You'll notice that I've put question marks on everything but that one, because everything else is even more uncertain than calculating the COLA. Next bullet, employee health insurance increase. Well, we've talked about the fact that, Miss Nancy has been told by a few that you're looking at that certain percentage increase, but anyway, the scale of that, if you will, goes anywhere from $600,000 to $1.6 million. So at the moment, we're just putting an assumption of $1 million for that, and we hope to have those numbers the first part of April. The DSS Big Beautiful Bill impacts at the moment are $368,000. The GFL convenience centers, again, you're looking at $1.2 million per year if we had to fund that. The new Hopton High School, we're being told at the moment anywhere from $7 to $10 million. And then for economic development, should we decide to move forward with something, as Ray said, that a shell building that would give us a quicker win, if you will, depending on what size we would decide to go with and so forth, we're looking at anywhere from $3 to $5 million for that. Moving to the next slide, just want to talk about some options that we could look at. But we know right out of the gate, as we've said a couple of times, we first need answers for GFL convenience centers, as well as the fiscal impact of the employee health insurance. That would certainly help us have a little more certainty in planning for the budget. Now, it's possible we could consider borrowing money for the new Hopton High School deficit, as well as the economic development project. Again, these are just simply options, and we'll flip over to that shortly. But before we go there, I want to finish with this slide. Now, this next bullet, the third bullet here, certainly would not be very popular with some, but we have a 2% early discount for paying taxes prior to August 31, that each year that's lost revenue for the county of $400,000 to $500,000. So for example, for this current budget year, it was $474,000, I think you said, Jim. So again, just trying to, knowing all of these different things that we're faced with, trying to figure out where there may be some additional revenue, to know that this would not be a tax increase, to know that this affords us not having to hit the fund balances hard for things, for needs. I think this, it all has to be taken into consideration, certainly. And then finally, the last bullet, utilize the Sampson County Schools capital reserve of $2.4 million or a portion thereof towards the Hopton High School deficit. Now, the way this capital reserve is currently set up is that money cannot be used for new construction. The ordinance reads that it has to be for things like a roof or equipment such as chillers and boilers and expensive things like that for in terms of capital projects. So that's what that is for. You certainly want to have a certain amount in there, perchance you have an emergency of some sort, and the need would be able to be satisfied if you did. However, maybe, if you considered taking a portion of that, $1 million or $1.5 million or something, I know it's a gamble, but that's one source to at least help, perhaps. But again, because of the way this is set up, it would require a board resolution for you to approve the use of that account in that fashion. Moving to the next slide, I just want to give you an example when Melissa was helpful with providing this information. She talked to Andrew Carter, basically our financial consultant. He's the one that had come. He helped us with the bond refunding, and he came and appeared before the board a few times, just to remind you of who he is. And this just gives you an idea that if we were, again, just for instance, for the new Hopton High School, if you borrowed $7 million and you're looking at a 20-year loan, and you see it goes down to year 21 actually, but it shows that if you were to borrow $7 million when it's all said and done, you will have paid $10.8 million based on a 5% interest rate. If you borrow $10 million for the same length of term in terms of amortization and what have you, you're looking at $15.4 million for the total cost of that loan for $10 million. Moving to the next slide, similar format for economic development financing options. If you borrowed $3 million at a 5% interest rate, again, you're looking at a little over $4 million for the total loan, but this is a 10-year term. And then if you borrowed $5 million, 5% interest rate, you're looking at $6.5 million for that 10-year note. So I just wanted to share those options. And then moving over to final thoughts, we've said it repeatedly, but even with the things we're faced with, there will be no property tax increase. I think it's important to note, me and Melissa and Jim have talked about this at length, is that 2.1% minimal revenue growth over last year, which is not that significant really, and I think Melissa may have mentioned that a while ago. Property tax, which is our largest revenue stream, is certainly under scrutiny. And I think it's very important. We have to really be mindful of that because there's so many unknowns and what ifs related to property tax reform that if we take on additional debt, we really need to think about what does that mean? What does that look like in the future? You have the uncertainty of the HR1 impacts in subsequent budget years. Pardon me, I'm having a hard time with the time change. I'm a little sluggish here. But with that in mind, though, as we had said earlier, it could be anywhere from nothing, which is likely, it sounds like it would be, based on the presentation from Ms. Santos, there would be something there more than likely, but it ranges all the way up to $3.2 million. And again, that's a huge unknown. And then finally, consideration of the following towards our fiscal challenges. Again, one consideration could be the elimination of the early pay discount for taxes, and then use of some portion of the school's capital reserve towards the deficit for the new Hopton High School. So finally, you will go ahead and advance, please, Stephanie. The budget calendar, I just want to share with you, of course, staff are entering a period in which the work on the budget will take precedence over other things. And statutorily, the budget officer must present a budget to the board no later than June 1st of 2026. And in just under 90 days, the budget officer and staff will attempt to address the desires of the board and balance requests against available resources. So I just want to hit some high spots with you about the budget calendar. For March 16 through March 31, the budget team, which includes myself and several others of our main admin group here, we will be meeting with the department heads. And so it's important to note that that's some other unknowns, is I will have, at the moment, I don't have as much information from the department heads as I will when I sit down with them individually. So obviously, we need to factor that into the planning as well. April 23rd is the first budget workshop session, and April 27th is board workshop session number 2. May 11th is budget workshop session number 3, and May 18 board budget workshop session number 4. I just want to mention about those that, first of all, the manager and department head meetings are not public meetings. Of course, that'll be just us meeting informally. However, each of the workshop sessions are open public meetings for the board, obviously, that the department heads will come and present their information to you as well. And then June 1st is the statutory deadline for the official budget recommendation to the Board of Commissioners, and that will take place in our regular June 1st or June board meeting is when that will take place. And then June 15 will be the proposed public hearing, and June 22nd is the special board meeting to consider budget adoption. So again, I know we have inundated you with information tonight, but I think it was critical that you hear all of the things that have been presented. Certainly appreciate your time and attention for us, and staff is ready to move forward. And certainly, if you have any questions or concerns, feedback, what have you, please let us know. And that's all I have, Mr. Chairman.
Okay. Do you have any further questions from the board?
At this time.
He just says he's tired, so that'll be big enough for me. All right, I'll entertain a motion to adjourn.
Make such a motion that we adjourn.
Motion to adjourn. And a second. All those in favor? We are adjourned. Thank you.